Hello doctors, welcome back to Enamel Heroes. Today we are here with another important topic. That is posterior triangle of neck. So here comes the introduction. It is a triangular space on the side of the neck behind sternocleidomastoid muscle. It is divided into two parts by inferior belly of omohyoid, forming two triangles. It forms two triangles. The posterior triangle is a space which is divided by inferior belly of omohyoid, forming two triangles. The upper triangle is occipital triangle and the lower triangle is supraclavicular triangle. Now comes the boundaries. Anteriorly, the boundary is posterior border of sternocleidomastoid muscle. Posteriorly, the body is anterior border of trapezius muscle. Inferiorly, the boundaries are superior aspect of middle third of the clavicle. And superiorly, the meeting point of SCM. What is SCM? It is sternocleidomastoid and trapezius at the superior nuchal line of the occipital bone. I'll be showing you the picture. This is a picture. I'll explain you with the diagram. As you can see, this muscle, this is trapezius. This is trapezius muscle. Okay, and this is SCM. What is SCM? Sternocleidomastoid muscle. And the area that I am coloring with green, this is the posterior triangle. Okay, and the area that I am coloring with yellow is the anterior triangle. And we are here to discuss only about this area, that is posterior triangle. So as I have explained you the boundaries, anteriorly, the boundaries anteriorly the posterior border of sternocleidomastoid muscle. And let's see the figure. Anteriorly, this is the anterior and this is the posterior border of sternocleidomastoid muscle. This is your sternocleidomastoid muscle and this is the posterior border. The posterior border of sternocleidomastoid muscle forming the anterior boundary of the posterior triangle. Okay. Now let's see posterior. As you can see in the figure, the anterior border of trapezius muscle, forming the posterior boundary of posterior triangle. Okay. Now inferior, superior aspect of middle third of the clavicle. Just look into the figure as you can just appreciate the clavicle bone. So the inferior boundary is formed by the superior aspect of middle third of the clavicle. Now superior, the meeting point of sternocleidomastoid and the trapezius. Now just look into the figure. You can see superior nuchal lines. This is basically the meeting point of sternocleidomastoid muscle and the trapezius muscle. Okay, and this forms the superior boundary of posterior triangle. Now roof. The roof of the posterior triangle, how it is formed? It is formed by the investing layer of deep cervical fascia. Okay, it is formed by the investing layer of deep cervical fascia and it contains platysma. Platysma is a muscle, external jugular and posterior jugular veins and cutaneous nerves. Okay. Now the floor of posterior triangle. It is formed of four muscles. First is semispinalis capitis. splenius capitis, levator scapulae, and scalenus medius. Now, the contents, as I have already explained you, the posterior triangle is divided into the two triangle, means it forms two triangle by, and that division is by the inferior belly of omohyoid. So the upper triangle is occipital triangle and the lower triangle is supraclavicular triangle. I'll explain you with the figure. This is the figure. As you can see, this is basically our posterior triangle, and you can appreciate this muscle here. This is inferior belly of omohyoid. This inferior belly of omohyoid divides the posterior triangle into the two part. This upper part, this is occipital triangle, and this lower part, it is supraclavicular triangle. Okay. Now let's get into the PPT. The floor it is formed by the four muscles. I'll show you the muscles in the figure. The first muscle is the semispinalis capitis. As you can see, this is semispinalis capitis. Then splenius capitis. As you can see, this is splenius capitis. And the third muscle is the levator scapulae. You can appreciate here levator scapulae extending till here. And fourth and the last muscle is scalenus medius. This is scalenus medius. Now you can appreciate, my students, these four muscles. If question comes on posterior triangle, you are supposed to draw all these diagrams. Okay? Because diagram is anatomy, anatomy is diagram. Without diagram, the text is incomplete. You will not be getting any good marks. So it is very important to draw well labeled diagrams as well as colored and well labeled diagrams. Okay. Let's get back to the topic. So what are the contents of occipital triangle and supraclavicular triangle? As I have already explained you, the posterior triangle is divided into the two. The occipital triangle, that is the upper triangle, and supraclavicular triangle, which is the lower triangle. Okay. So let's see what occipital triangle has. What is the content of the occipital triangle? It has spinal axillary nerves, third and the fourth cervical nerves, dorsal scapular nerves, that is C5, four cutaneous branches of cervical plexus, superficial transverse cervical artery, and occipital artery. I'll be showing you everything in the diagram, but first just understand what is there in the subclavicular triangle. It has third part of subclavian artery, subclavian vein, terminal part of external jugular vein, trunks of brachial plexus, superficial cervical, suprascapular and dorsal scapular arteries, and lymph nodes. See students, you can write as it is in your exams in the same form, in the same sequence form, under the same heading, and you will get really good marks. Okay. If the question comes on posterior triangle, be it a long note or be it a short note, you are supposed to write in the same form, means under the same headings. The content should be introduction, boundaries, along with the diagrams, then roof, how roof is formed, what it contains, then floor, how floor is formed and what are the contents, contents of both the triangle, that is occipital triangle and the supraclavicular triangle, how the posterior triangle is divided into the two, everything. You're supposed to write everything in the exam along with the diagrams, and all these 3 diagrams that I have shown you in the picture is very important. Okay, so I'll be showing you the contents of the triangle. So the upper triangle, as you can appreciate, this is the upper triangle, which is occipital triangle. What it has? It has occipital artery, it has lymph nodes, spinal accessory nerves, lesser occipital nerve, greater auricular nerve, and transverse cervical nerves, supraclavicular nerves. Okay, then it is divided by the inferior belly of omohyoid, and now it forms supraclavicular triangle. It contains subclavian artery, subclavian vein, and the brachial plexus. All the 3 trunks: upper trunk, middle trunk, and the lower trunk. So student, these are the contents of posterior triangle. If question comes on posterior triangle, you are supposed to write content of the posterior triangle, that is both occipital triangle as well as supraclavicular triangle, along with diagrams. Okay, now one more very important question that comes from posterior triangle is Frey syndrome. Student, it is very important. It comes in short note. It can come in 3 marks question, it can come in 5 marks question also. So it is very important to know what is Frey syndrome. It is a part of posterior triangle only. Okay, it is a rare neurological condition that causes sweating excessively while eating or thinking about the food on the areas like cheeks, temple, and around your ears. And this syndrome most commonly develop because of the side effect of the surgery. And surgery of what? Surgery of the parotid gland. Okay, and there are other names also for this syndrome. In examination it can come also under the heading auriculotemporal nerve syndrome, gustatory sweating, or gustatory hyperhidrosis. Okay, so it is very important for you to know these names also, because question can come in exam from these names also. So it is important for you to remember all these names. So now I'll be telling you the PYQ, the most important. I think you have been waiting for PYQ always at the end of the topics. So from this topic that I have covered, long note can come in both 8 marks or 10 marks also, with the question posterior triangle of neck along with introduction, contents, boundaries. You are supposed to mention everything in the answer. Then roof, then floor, and the contents of individual triangles, that is occipital triangle and supraclavicular triangle. Okay, and one short note can also come on Frey syndrome. this is very important. Many times they ask Frey syndrome in both your internal exam as well as in your professional exam. So it is very important for short note purpose. Okay. So that's it for this topic. I guess I have cleared your doubts and I have make you understand the entire topic. I hope now you have a better understanding of the topic. So thank you. Hope you all are doing well. And see you with another important topic. Okay.